This video is intended to provide guidance as to how to establish patterns between what events could exacerbate your specific symptoms and make you feel worse for purposes of developing your own guidelines on your path to recovery. In the short term and midterm, it may be difficult to determine specifically what tangible changes result in an overall improvement in your condition. In an upcoming video, we will delve into the suggested dietary changes and supplementation, which will result in lifestyle changes. For now, it might be an easier route to determine which things being exposed to make you feel worse. These are not limited to, but could include food sensitivities, poor quality sleep, stress, overexertion, and consumption of sugar at particular times. You can make note of these specific things that make you feel worse in your notes, in addition to the calendaring that we will begin on the next set of slides. For example, on a particular evening, you may find that you do not sleep well and suffer poor quality sleep. Overall, you feel worse the next day, and as a result, in a conjunction to feeling worse, your stomach or IBS symptoms may follow. Non-restorative sleep, for example, has been particularly noted as a contributing factor to the increased feeling of fatigue that also intensifies the pain. You may find that the evening before you consumed sugar prior to bedtime or sugar on the previous day. As a result, you may begin to make these causal connections between the effects of feeling worse and different foods that you have consumed the evening prior. You'll begin to notice how some of your symptoms travel together. For example, on the nights that you sleep poorly and you have consumed fruit or sugar in the evening, your symptoms will be aggravated the next day as a whole. The purpose of establishing these patterns is to attempt to find some keys towards the exacerbating factors which may have led to your negative cycle. You should now purchase or create a monthly calendar where you would begin to start to chart your progress. A suggested way to do this is by recording 3 of the following 4 categories, in which you will assess your pain level, fatigue level, muscle strength or overall weakness, and overall your strength level, with 10 being the best and 1 being the weakest. You may begin to find that as you move along the spectrum, your ability to function and exercise improves significantly. That is, on the days where you are 5 and above, your ability to exercise improves, as does your ability to move around and function more effectively. Be patient. This will require some time. You may start on the spectrum at a 2 or 3, and over the course of 3 to 6 months, you may gradually move to what is steadily becoming a 6 or 7. However, you will begin to see improvement.